The Women's Center at UConn Health wants to help you feel your very best. Whether it's painful menstrual cycles, infertility, or other issues, you do not have to suffer or be in pain.
Melissa Cole visited UConn Health to learn about some new procedures. Let's take a look.
Meet Dr. Anthony Luciano and Dr. Amanda Ulrich of the Women's Health Center at UConn Health.
We treat almost the entire spectrum of women during their reproductive years, from the time of puberty to the time of menopause.
Painful periods, excessive bleeding, fibroids, and endometriosis are just some of the women's issues the doctors treat here. And their specialty is taking care of them without surgery. They use minimally invasive procedures instead.
So minimally invasive procedures basically mean procedures that have either minimal incisions or no incisions on a patient's body. So we have a wide range of minimally invasive procedures that we offer here. Some of the advantages include faster recovery time. Our patients typically go home the same day of surgery. Their recovery time is a lot faster. They also have less blood loss. They have less chance of infection, less chance of post-operative complications requiring additional admissions to the hospital, and overall they're able to get back to their normal life and better quality of life much faster.
The traditional approach of surgery would require several days in the hospital, as well as a much longer recovery period that could be up to 4 weeks. That's time away from work or not being able to care for the family. So this minimally invasive approach takes away all of that burden. A patient can go home the same day and return to work and other daily activities within 2 to 3 days.
This is a uterus, and these are fibroids in the uterus, okay? And they can cause heavy bleeding, they can cause a lot of pain, and they can cause infertility. So what we do is laparoscopically, through minimally invasive surgery, we make a small cut here on the surface of the uterus, we pluck out these fibroids, these tumors, and then we close the uterus and restore normal anatomy and normal function of the uterus. And the symptoms that they had before, heavy bleeding, infertility, etc., usually go away.
And how common are fibroids?
Almost 80% of all women will develop fibroids, but only 25% of them are symptomatic, i.e. develop the symptoms that we talked about that we need to treat.
Endometriosis can be treated in a similar way, with patients reporting much less pain after the procedure. So ladies, listen up. The doctors here at UConn Health want you to know you don't need to suffer. They can help and they want to help.
They should not be suffering anymore. They can come, they can see us, and we can help them.
That's the best message you can give them. They don't need to suffer. There are solutions to this.
Because I think women, we go along, we're working, taking care of the kids, we kind of put our health on the back burner a lot of times.
True.
And we know we can kind of make it through even if we're in pain, right?
Yes.
Do you see that?
I see that, and also see there is a culture about women's pain that is unjustified. And I mean, the suffering that many women go through, they think, well, that's a woman thing. It's not necessarily a woman thing. That could be fixed. That could be corrected. And we can help you with that.
I've seen a lot of patients who come and they start telling me about the pain that they've been having and how long they've been suffering and how many providers they've seen. And then at the end of the visit, they start crying that they're so thankful that someone they feel like is listening to them and can help them, and they're very grateful for their care.
All right, they are accepting new patients. For more information, visit health.uconn.edu. Thanks, Melissa.